Can you exercise if you have a chronic condition? Of course you can. All right, that's the topic on Healthier You. I'm Jane. I play your host today, reminding you that we have a medical disclaimer, and so let's go into that. Always check with your physician before starting any exercise or dietary program. Information here is my personal research into different health topics and should not and is not considered medical advice. Now, there are a lot of people who think because they have a chronic condition they cannot exercise, but we're going to go over a couple of reasons why you might want to exercise with those chronic conditions. To be honest, the people who benefit the most are most likely going to be those people with chronic conditions. You can usually do walking at the very least. Sometimes just riding a bike or using one of those stationary pedalers in your home. Swimming, weightlifting, gardening are all safe. And most especially if you are just starting to build up slowly, and do that slowly. And always you can talk with your doctor, healthcare team about ways to increase those kind of things for you and what they might suggest. Now, Alzheimer's disease and related dementias, there is some evidence that shows that it actually reduces the risk of these conditions and may help delay or slow them by keeping physically fit. It can also help you feel better, maintain a healthy weight, and have regular toilet and sleep habits, which can become difficult with those folks who do have dementia or Alzheimer's. Older adults with what they're now calling as mild cognitive impairment, MCI, might be able to exercise the same way as someone who does not have any cognitive impairment. Whereas people with dementia may need help from their caregivers. So if you're the caregiver, try exercising together and adapting activities to make being active a lot easier and more enjoyable. Be realistic about how much can be done at one time. Usually you're probably going to be better with doing short mini workouts than one long session. And as always, if you are the caregiver, make sure that you are talking with your doctor about what they may recommend for the situation at your household. Arthritis. The most common is osteoarthritis. Older adults who regularly exercise show that they have decreased pain, improved physical function, and quality of life. Both aerobic and muscle strengthening activities do contribute to these benefits. So they suggest that you try low impact activities such as swimming, walking, Tai Chi, which those all put less stress on your joints. And yes, Tai Chi is considered an exercise. And if you've ever done a lot of Tai Chi in one afternoon, one evening, it is physically a workout. When done safely, physical activity with arthritis shouldn't make the disease or pain worse. Chronic pain. Physical activity, like I said, is helpful in use of pain management, whereas being inactive can actually lead to a cycle of more pain and loss of function. So keep that in mind. It's important to remember to listen to your body when exercising, participating in any physical activity. Avoid over-exercising on good days. If you have pain, swelling, inflammation in a specific area, you may need to focus on another area or rest for a day or two. Chronic obstructive pulmonary disease, which a lot of us know as COPD, There are some there are some exercises that you can do that will help you strengthen your arms and legs, and along with that, breathing exercises that can help strengthen those muscles needed for breathing. This one, most everyone I know, doctors included, suggest going through a pulmonary rehabilitation program. These programs help you learn to exercise and manage your disease with physical activity, and counseling can also help keep you active and have the ability to carry out your day-to-day tasks. You know, a lot of us consider sweeping, cleaning, not much exercise. Nowadays, they are considering that exercise. But for someone with COPD, that can totally wear them out. So, yeah, there's that. Obesity. Looking at it. If you are overweight and have obesity, don't let that stop you from being physically active. Anything that gets you moving, even if it's only for a few minutes a day, in the beginning is a healthy start. Slowly work up to more. If you have difficulty bending or moving easily, feel self-conscious, try different activities, such as walking, water exercises, dancing in your house, weightlifting to see what works best for you. I like using the infinity hoop, and generally what I do with that is I've got the radio on for Christian music radio station, and I'm listening to it and praising God, praying sometimes while I'm doing it. I do a lot of walking. I wouldn't say gardening because I don't really have an area to garden yet, but I do a lot of physical work such as weed eating, cutting the bamboo, all kinds of things like that around the house. And in the winter it sucks because I can't do those things. The most I get forward to looking to is shoveling the driveway, and I'm not a fan of that at all. Osteoporosis, talk with your healthcare provider about physical activity that is safe for you and good for your bone health. Combination of exercise types can help build and maintain some healthy bones and prevent falls and fractures. Weight-bearing exercises such as walking, climbing stairs, dancing produce a force on the bones that makes them work harder. Include muscle strengthening and balance exercises because that can be very beneficial for that. And those of us that have type 2 diabetes, physical activity can help you manage the type 2 diabetes and stay healthy longer. It improves blood glucose levels, can prevent or slow risk factors that contribute to the disease getting worse, and helps protect against the leading cause of death in people with type 2 diabetes, cardiovascular diseases and such. So they continually aim for 150 minutes per day. Per week. 150 per week. So when you break that down, divide it into five days a week, that's 30 minutes a day. So not too bad. And then they also tell you to make sure you do 2 days of muscle strengthening activities. And they do suggest that you set a goal to be active most days of the week and create a plan that fits into your life. The only thing is, people exercising with diabetes, you need to be careful about monitoring your blood glucose, having appropriate footwear, and avoiding injury for your feet. So that's something to consider. Now, there's also a lot of things that you can do just around the house. Like I said, the house cleaning, those kind of things are helpful. So keep that in mind when you consider your exercise. But there are a lot of exercises that you can do simply in your house where you don't need extra equipment. So you might want to consider looking into some of those things. Like I said, I use the infinity hoop. There's a lot of different things. There's the the pedals that you sit on the floor and you can sit in your chair and use that. You can also use that same thing up on your tabletop for your arms, that kind of thing. Change the resistance for both of it. That'll help with leg strengthening, those kind of things. Thomas years ago bought a Gazelle. I have not used that. And so now I'm looking at some of the videos on how to use it and considering adding that in for a few minutes per day as well to help with that. All right, guys, that is it for today's video. Hope it helps you a little bit, gives you a little more incentive to get active, that kind of thing. And as always, do something kind sometime this week. And I'll see you again next week. Bye.